Hi, this is Sunil from Ravel Therapies, providing remedial massage in Limassol, Cyprus. I thought I would share some massage therapy techniques with you that I use at my clinic in Neutral Bay. Today we're going to look at the TFL muscle and the rectus femoris. So yeah, just position that ankle and that knee, taking the knee across, and you can move that around. Just wedge your elbow in gently and taking that knee across. It's a great way to stretch that TFL out. And again, if you're working myofascially, just take your time sinking in just past the ASIS, which you can feel with your forearm, just going lateral to the ASIS and up to the iliac crest, and you'll be capturing most of that TFL muscle. It's a great way to work on the trigger points as well, so if you've got some active trigger points in that area, you can find the trigger point and just gently sink in your elbow in there. And just wait, applying sufficient pressure that your client can feel the pressure and feel a bit of pain, but not too much. She should be able to relax into it. And then what I often do is I just roll the elbow around slightly. Just encourages that muscle to let go a little bit. And slowly easing off. Take that leg down again. Another nice way to work the lateral area is just up here. You can use your forearm. And I like to roll the leg when I'm doing this, so you wedge that in and you roll that leg medially to stretch the lateral side. So just make sure there's no pain in the knee with your client, and just pulling that muscle superiorly and releasing all that fascia. It's not too hard for you, Camilla?
It's awesome.
I prefer to work quite slowly with these sorts of techniques, because it just gives the body a chance to let go in its own time, rather than just briskly going up and down, which is quite a different technique altogether. Of course, every now and again you can just put some nice broad strokes in there. You can bend this here, sitting on the leg, sitting on the foot, so it doesn't slide down. And you can do a bit of gentle cross fiber through here as well. You can reinforce your fingers if you need to. And again, just taking that tissue and rolling it laterally, because again the lateral muscles roll medially in their dysfunctional position. So you tend to have the vastus lateralis and the TFL, and you find that the ITB rolling over in a medial direction. So again, it's a great way. You can do that with the leg down as well. A great way to just work that fascia and pushing it laterally, so pushing it out. And you can use that kneecap just to move it medially to get that stretch happening, and just feel that fascia releasing as you take it laterally. And the last thing I would probably do in this situation is just to release the inferior and superior tendons of the rectus femoris. So we can just roll over. It's quite a common technique. Just roll over the patellar tendon or the rectus femoris muscle here, just underneath the patella, and it can be quite good at just getting that tension out of that muscle. So just some gentle cross fiber work. And of course the superior tendon as well. So you find the ASIS, and then just a couple of centimeters down is your AIIS, which is the attachment site of your rectus femoris. So you can just grab the knee and just brace it against your body. Just relax and let go, Camilla. And just wedge your fingers into that attachment site, and you can just roll the leg, the femur. Just roll that, keeping your fingers on that tendon to get a nice cross fiber release of the superior tendon.